Yeah, my name is Tom Goodwin. I'm an orthopedic surgeon here in Boise, Idaho. I moved here when I left the Air Force in 1987, and I've been practicing here since that time. In 2002, I established the Shoulder Clinic of Idaho. I try to talk to people like I talk to my brother and say, hey, you know, this is the way it is, and here's your alternatives. And if there's some non-surgical things, know what those are, but if surgery comes down the pike, then really let somebody know what they're in store for. Our primary approach is if we can solve a problem non-surgically, that's optimum. Sometimes it just can't be done, or the pathology is such that wouldn't take care of the problem. The things we offer prior to surgery are sometimes anti-inflammatory medication, physical therapy. I've got some people I send to chiropractors for different types of things that I can't offer. We're actively engaged with physical therapists around the valley. There's a very active population here with running, climbing, skiing, and so we've got a gamut from basically 14 years of age up to in the mid-90s, really. The procedures we most commonly do are arthroscopic procedures through a little scope of the shoulder for rotator cuff tears, calcium buildup spurs, some cartilage repair, and we also do shoulder replacement, much like a hip replacement, but for the shoulder. Yes, we're very fortunate here in Boise. It's a small town. It's not very large, but we're real fortunate as we have a surgery center right across the parking lot from us. It's 125 yards probably to the front door. They really provide the best opportunity for us to provide care for the patient. They just purchased in the past year a new arthroscopy system whereby the visualization is incredible. It's the latest up to date in terms of clarity and functionality and being able to watch different angles of a patient's shoulder with the scope while we're there. I've probably performed surgeries in the shoulder by just the shoulder per se, about 10 or 12,000 in the past 13 years. I think that the current technology is aimed at cartilage sparing procedures, commonly known as a joint preservation, which tries to maintain what we have rather than just putting in something that's artificial. Try to maintain as much as we can what we have and amplify upon that to try to let Mother Nature take us as far as we can with what we do have before we alter things with implants or different types of procedures which we save as a secondary option. We do non-operative as well as operative care of the shoulder. The most common shoulder procedure we do are rotator cuff repairs, cartilage repairs, specifically ones that's called the labrum of the shoulder. It's a cartilage rim that goes around the joint. We do shoulder replacement, much like a hip replacement, but made for the shoulder as well. My best success story is my wife. I operated on my wife, believe it or not, for a cartilage tear she got playing college volleyball years ago. And she talked to me about it, and we tried all the non-surgical maneuvers. And she's a physical therapist, so she already knew some of the things to do. We tried different avenues of injections and therapy. And she's about 2 years out from her arthroscopic shoulder surgery, and she's doing really well. She's back doing all the athletic activities she enjoys and seems to be comfortable at home. And I've taken care of other, you know, like I said, there's a lot of weekend athletes here in Boise that really demand, you know, the best of their knees and shoulders. And I think we've got a majority of those back to what they want to do for their sport. I just feel blessed to do what I do. I enjoy it tremendously. People oftentimes ask me when I'm going to retire, and I say I've got no end in sight. I enjoy what I do. It's a real pleasure for me to be able to come in and work with people and get them as best I can and meet their goals. So I've got no retirement end in sight. As long as I'm healthy, and I'll be here till the sun sets.